Good evening all. I am Dr. Dipin Kumar from ICRA Hospital, Sultan Bathery, Wayanad. Today's topic is healthy diet for healthy heart. In today's session, we will discuss about the role of healthy diet for keeping our heart healthy. Normally, in a healthy person, blood pressure rises and falls throughout the day. But pressure higher than the normal for a longer duration can damage the vital organs like heart and kidneys. Persistent increase in blood pressure higher than normal blood pressure is known as hypertension. So hypertension has no warning signs and symptoms, and many people even do not know that they have it. Thus, it's frequently known as a silent killer. A high blood pressure increases the risk of several cardiovascular complications like heart attack, heart failure, arrhythmia, peripheral artery disease, and stroke. So heart diseases are the #1 cause of death globally, and more people die annually from CVDs than from any other cause. Cardiovascular diseases are one of the most common lifestyle diseases. Some of the most prominent factors increased incidence of heart disease include sedentary lifestyle, stress, excessive salt intake, smoking, and excessive intake of alcohol. Nowadays, the numbers of safe and effective medicines are available to treat hypertension and other heart diseases. But let me tell you that all lifestyle medications like exercise and dietary changes are equally effective as medicines and can also help a person to lower high blood pressure and prevents progression to heart diseases. Hence, certain dietary approaches like DASH diet and Mediterranean diet have been engineered to reduce high blood pressure. In addition to this, specific dietary changes are also needed to manage for uncontrolled hypertension. We will discuss these required changes one by one. First one is reduced salt intake. A high sodium diet is well known to increase blood pressure. Packaged and processed foods are the main source of salt in diet. The human body requires small amount of sodium in the diet, and approximately less than 1500 milligram per day, and most people consume more sodium than they need, like more than 3 grams per day. In fact, less the sodium you eat, better blood pressure control you may have. To lower the sodium in the diet, one can try some measures like using a food diary to keep a track of salt in the food you eat, increasing the intake of salt-free food such as seasonal fruits, aiming for less than 2.3 grams, that is about 1 teaspoon of salt each day, and reading the nutritional facts label on each food package, and avoiding foods that have 20% or more daily value of sodium. Avoid canned foods, processed food, junk, and fast foods. The second one is the limiting of alcohol intake. Actually, this is not limiting of alcohol intake. You have to avoid alcohol itself. Drinking an excessive amount of alcohol increases the risk of developing heart disease. So people who consume more than 2 drinks per day have an increased risk of heart complications such as compared with non-drinkers and a binge drinking. So take home message is don't drink alcohol. Third one is cutting down number of tea or coffee. Tea, coffee, and other caffeine-rich drinks can increase the blood pressure. So reduce your caffeine intake, like reducing the coffee or tea as much as possible. Next one is eating more fiber, fruits, and vegetables. On the other hand, potassium, magnesium, and fiber may also help to control the blood pressure. Fruits and vegetables are high in potassium, magnesium, and fiber, and low in sodium. And many breakfast cereals are excellent source of dietary fiber. Stick to a whole fruits and veggies. And juice is less helpful because the fiber of the fruit is destroyed and generally has added sugar. Also, nuts, seeds, legumes, lean meats, and poultry are good source of magnesium. Combining these dietary changes with a proper diet plan can significantly reduce one's high blood pressure and prevent heart disease. One of the most well-known dietary strategies for lowering the risk of heart disease is the DASH diet. So we can have a look into what DASH diet is. And DASH means dietary approaches to stop hypertension. This is a well-known diet in the management of hypertension. And this came into practice to combat high blood pressure and reduce the risk of heart disease. It emphasizes the right portion, size, and variety of foods and nutrients. Basically, it is an eating plan which is rich in fruits, vegetables, whole grains, fish, poultry, nuts, legumes, and low-fat dairy. It doesn't require any special or pre-packaged meal. Rather, it relies on many standard foods one may already have in their home. Diet includes more of the foods that are naturally low in salt, cholesterol, and saturated fats and foods. They are high in potassium, calcium, magnesium, and fiber. DASH cuts out desserts, sweetened beverages, fats, red meat, and processed meats. So a typical serving guide for a patient following daily and weekly DASH diet goals for a 2000 calorie per day. And that include grains, about 7 to 8 servings a day, lean meat, poultry, and fish, 2 or fewer servings a day, vegetables 4 to 5 servings a day, that's very important, and fruits 4 to 5 daily servings, low fat or fat-free dairy products like 2 to 3 servings a day. Total sodium intake should be less than 2300, and nuts, seeds, and dry beans like 4 to 5 servings a week, and sweets 5 or less servings a week. This is all about servings of DASH diet. Next most important diet is Mediterranean diet. So Mediterranean diet also have similarities with the DASH diet pattern, but is generally higher in fat, primarily monounsaturated fat from olive oil, nuts, and seeds, commonly close to 40% of daily energy. Let us talk over how these healthy diet plans can improve the heart health in patients having cardiovascular complications. And diet encourages the intake of foods that is rich in potassium, magnesium, calcium, and helps in reduction of sodium in the diet to about 1500 milligram a day. DASH diet generally includes about 2000 calories a day. Due to avoidance of fat-rich food, it reduces triglyceride level, improves HDL, that is good cholesterol, and also reduce LDL levels, that is a bad cholesterol. Hence, this can be worked as a successful tool in weight management, and it indirectly helps the persons to lower high BP and have healthy heart. Diet plans also cut intake of sweets, sugar-containing beverages, so lowers the risk of development of diabetes and other heart diseases. And this improves health of patients with heart failure. So the healthy diet eating plan is just one key part of the healthy lifestyle. And combining it with other lifestyle changes like physical activity can help you to go for more control in blood pressure and LDL cholesterol for healthy heart. Accompanying healthy diet, person should also get at least 30 minutes of moderate intensity exercise most the day, like at least 5 days a week. Examples of exercise include brisk walking or riding a bike. A person can aim to get at least 2 hours and 30 minutes of exercise per week. At this time, I would like to suggest some idea that can help you make the healthy changes. Don't be discouraged if following the diet difficult at first. Start with small, achievable goals. Try making 1 or 2 changes at a time until you can do it all. So learn to read labels. So by knowing serving size, you will know how much sodium you are getting as per serving. And use spices and herbs to flavor your food instead of salt. Choose fewer processed foods that contain more sodium, and look for foods that say no salt added or sodium free or low sodium. Avoid fried foods. Grill, steam, roast, or poach your food instead, and slow down when you eat and exercise simultaneously. Lastly, the bottom line is diet plays a crucial role, not only in developing, but also in controlling the progression of heart disease. I advise to all patients to adopt a healthy lifestyle, which plays an important role, not only in treating heart complications, but also in preventing it. Thank you.